Alright. Good afternoon. It's great to see everyone, and we haven't been together in a virtual town hall now for a while. So as we get ready to have a limited return to campus starting in a little over a week, we thought it'd be a good idea to get everyone together and for a conversation about the return and other things on your mind. My name is Ken Kettenbiel. I'm the Vice Chancellor for External Relations, for those who don't know me. And I'm joined today by Chancellor Grasso, Provost Alcock, and Emergency Management Director Laura Drabczyk. We also have other leaders in the wings, if you will. Should you ask tough questions that we can't answer, we may defer some questions over to them. And the purpose, as I mentioned, of today's webinar is just to get us acclimated for the limited return to campus, which is scheduled for March 1st. Hopefully you've all had an opportunity to read the email that the Chancellor and the Provost and Brian Dady, the new Vice Chancellor for Business Affairs, put out this week. We're going to go over the highlights of that email. We're going to answer questions that we received in advance of today's town hall. So thank you for those. We're going to address those. And if you have any questions as we go through the presentation, please use the Q&A tab on the bottom of the webinar. That is how we will address questions that come up today. An added feature, it was requested that we turn the chat on, so you're allowed and have fun in the chat room with each other. That was suggested by Faculty Senate. I do want to just point out that we're not going to be looking for questions in the chat. There's too much going on for us to monitor everything. So we're not ignoring you. If you have a question or if you need us, if you want to make us aware of a situation, please, or a question, please hit the Q&A. So with that, I hope that I'm going to turn it over to the Chancellor shortly, but I hope today you walk away with a sense of optimism. And there's some good news, and I know we're not out of the woods yet with the pandemic, but there's certainly some things moving in the right direction that we're going to experience this semester that definitely give us hope. And while this isn't hope, one thing I was very grateful for is not having to commute this week to work with the snowstorms and with the 0-degree weather. So we can all take that as something very positive that's been omitted from our life, at least for the first 2 months. So watch the snow continue in March. But in any event, again, thank you for being with us today. And with that, I'm going to turn it over to Chancellor Grasso just to kick us off and also share some news, particularly about athletics that we learned this morning. So, Chancellor.
Thank you very much, Ken, and welcome to all our Dearborn Wolverines. Thank you for joining us for this town hall meeting. I want to start off, as I have with all of our town halls and all of my public speaking engagements with our campus, to thank you all for everything that you've done over the course of this pandemic. We have arrived at this point in our progress through the academic year in a very safe manner, and we've been able to deliver an outstanding education. It's all because of your hard work, resilience, and adaptability and effort. And I want to thank everyone for everything that you've done. We had a remarkably safe fall semester, and it's remained safe through the start of this semester, and we hope we're going to conclude this semester in the same fashion. We are looking forward to launching a limited face-to-face presence on March 1st. You're going to hear more about that very soon, but we're going to have up to 12% of our student credit hours taught face-to-face, which is a 50% increase over what we had in the fall, and we're looking forward to it. And I know that there are a lot of people that really want to get back to some human-to-human contact. With regard to athletics, I just want to give you a brief update, and I want to explain how we ended up here. We have always intended to try to bring our student athletes back to competition as soon as possible. We know it's important to them and to us. And we were very cautious in the fall semester, and rightfully so. There were a lot of outbreaks. A lot of teams had to suspend practice. Some conferences suspended for the whole year. So we arrived at this point, and we were hoping to bring our student athletes back for competition on March 1st. In preparation for that and doing due diligence, our former athletic director did a survey of other athletic directors in our conference to determine if they were willing to abide by our health and safety regulations, our public health regulations and protocols, because there was at that time, and still is not, any conference guidance on this. What he discovered was that the majority of athletics directors were uncertain if they would be able to meet our guidelines. Hence, we decided at the recommendation of the athletic department to suspend competition and just bring our students back for practice. Since that time, the Wolverine Hoosier Athletic Conference has proposed some tentative guidelines as of yesterday at 11 a.m. And some of the other teams in our conference are now willing to abide by our safety guidelines that we checked and verified with Dr. Preeti Milani, who's our Chief Health Officer for the university. So as it stands now, we are cautiously optimistic that we will be able to return to competition as soon as we can get back on campus after March 1st. It'll be a few weeks because we'll have to do some practice, training, and conditioning. But this has been communicated to the teams and the coaches through our interim athletic director, Brian Earl. And he's on the call as well and can answer any additional questions. Having said all of that, we are very optimistic about the spring and summer, and the fall in particular. President Biden has indicated that there will be enough vaccines to vaccinate over 300 million individuals, or the majority or all of the population that's eligible for vaccination by the end of July. And we are hoping that the positivity rates continue to abate. As of just a few minutes ago, when I checked the public health website for the state, Michigan is at a positivity rate of 2.85%, below 3%. We have not seen that since the summer, July. So that's terrific. Wayne County is a little bit higher at 3.9%, but that's still much lower than it had been. And I think that there is a cause for optimism, and we're looking forward to a fall. And President Schlissel indicated this at the Regents meeting, that may look considerably different than where we are now. And we're hoping, keeping our fingers crossed. But as Ken Beal just said, we are definitely not out of the woods. We cannot let down our guard. We have to be ever vigilant and make sure that we continue to be as careful as possible as we go forward. But we are excited about what the future holds for all of us. So with that, I'd like to say thank you again for everything that you've done. I look forward to hearing any of your comments and the responses from our team. And I thanked everybody on the call, but I do want to thank in particular the terrific leadership team that I have the honor and privilege to work with. They have done just an outstanding job, and we could not have gotten through this without their hard work and advice. So with that, go Blue, go Dearborn, and go Ken.
Thanks, Domenico. And just to clarify too, when you talk about our safety guidelines for athletics, it's not like we were asking for anything out of the extraordinary. I mean, testing, which is we're seeing in other athletic leagues across the country, and mask wearing, which we have to wear when we go to a grocery store. So it's not like what we were asking for was really absurd. So I just wanted to point that out as well.
Indeed. Right. No, and we were doing it for the welfare, health, and well-being of our student athletes and our community and their families that they go home to at nighttime. So we were trying to take care of our student body as well as allow them to compete.
And that's been our philosophy since the fall on all of our decisions. So consistent. And with that, I'm going to ask Laura to share her presentation and overview. And you'll see as Laura goes through the safety and security guidelines and efforts that we started in the fall are continuing through the spring. And Maria, if you can put up the slide that we did for Laura, that would be helpful as well. So Laura.
Great, thanks Ken, and hi all. It's great to see everyone, and I'm excited to be talking to you today about a small campus return after being fully remote since November. I will be highlighting our Winter 21 return to the classroom, available services, and COVID testing this semester. Your safety has been our top priority throughout the pandemic and during our return to campus planning efforts. We consistently monitor and respond to the frequently changing CDC guidance, MDHHS, and Wayne County Public Health guidance. Before I start with these topics, I too want to thank each of you for your patience, understanding, and adherence to the mitigation strategies we have in place. I know these things are not easy, and I recognize we want some semblance of normalcy. I assure you, we will get there. There are promising signs right in front of us, with a positivity rate at 3.9% in the county, as the Chancellor just mentioned, something we haven't seen in many months. Less than 1,000 cases in the state for the last 3 consecutive days, and the promise of more vaccines to come to our local health departments and healthcare systems. We have reason to be optimistic. So let's get started with the limited on-campus, in-person instruction return. These classes have been previously identified and include labs, senior design, and other courses that require a high level of interaction or specialized equipment. We anticipate 12% of classes to be delivered in person, and this is a 50% increase over the fall. Anyone who does not have a need to be on campus should continue to work remotely. If you have any questions, please follow up with your supervisor. For those returning to campus, you are still required to complete the Response Blue screening app and show your green check to the screener, who will take your temperature upon entry to a campus building. If you receive a red screen, follow the instructions in the app. You are still required to wear a properly fitting mask and maintain appropriate social distancing while on campus. As a faculty or staff member who may be returning for the first time to campus since the start of the pandemic, you are required to complete the online COVID-19 training. Buildings have been prepared for this return with purging of ventilation systems, enhanced cleaning, and strategically located hand sanitizing stations. In the classroom, you will find paper towel and disinfecting cleaner to wipe down surfaces. And throughout the day, enhanced cleaning will continue with the primary focus on high-touch areas. Should we receive a report of a positive campus case, there is a team comprised of our HR, student affairs, and emergency management that jumps into action to conduct contact tracing, provide support and assistance, recommend and track isolation and quarantine requirements. In addition to the focus on health and safety measures, we are committed to our student success. Therefore, the Math Learning Center and supplemental instruction will return to limited campus activities. These activities will be by appointment with a small number of tutors and students participating and adhering to safety protocols. The bookstore will be open with curbside and virtual services. The Mardigian Library will still provide curbside service for reserved material, and the food pantry will provide curbside pickup by appointment. Faculty, staff, and student study space is available by appointment. We are working on a plan to safely return a limited number of faculty to their office, so look for more information to come in late April. Research has continued since we started our ramp up in the summer and has done so safely and will continue to move forward in the fashion as they have. Counseling and Psychological Services, CAPS, is and has been providing service to our students since the start of the pandemic. Currently, there is not a wait time for services. If you feel a student is in need, encourage them to contact CAPS. If it is after hours, encourage them to contact the 24/7 crisis line. This crisis line is answered by a trained counselor who will assess and manage the situation and provide a report to CAPS for follow-up. In order to keep the campus safe and contain the spread of COVID-19, testing is encouraged for all of those students, faculty, staff, and graduate student instructors returning in person on or after March 1st. UM-Dearborn students living in cohorts at the Union at Dearborn, Fairlane Woods, or Fairlane Meadows are also encouraged to get a COVID-19 test. This is a voluntary program with costs covered by the university. To assist with COVID testing, the university will hold a testing clinic on Wednesday, February 24th in the lobby of the Fairlane Center South building. It is important to schedule an appointment. A link and phone number were provided in the Chancellor's email on February 17th and will be included in a message coming out later today. If you are sick, do not use this testing service. Go to the MDHHS website to find a testing location near your home. We are working to secure additional testing dates through the remainder of the winter term, so look for a future announcement. Now, I would like to take a few minutes to talk to you about vaccines. We are hearing a lot in the news about vaccines, vaccine rollout, and the number of vaccines distributed versus those administered. We have had 2 vaccine clinics on our campus for first doses, and we'll have 2 clinics to complete the second dose for those individuals. Unfortunately, at this time, we have no further clinics scheduled. I want everyone to understand that Michigan Medicine has been charged to provide vaccines to all U of M faculty, staff, students, and patients who want one. This is an insurmountable task, trying to vaccinate such a large amount of people with a limited vaccine supply and having to comply with federal and state vaccination requirements. Michigan Medicine currently is still vaccinating 1A and 1B individuals, but with a significant number of less vaccines than they received early on. I understand that folks are interested in getting a COVID-19 vaccine. So in the interim, I encourage you to get yourself on a list with your healthcare provider, local pharmacy, or local public health department. Michigan Department of Health and Human Services has information about vaccines and link to the area public health departments is where you can register. In closing, I want to thank you for your adaptability and tenacity. We will get through this crisis and will be stronger and more resilient in the end. Thank you. And with that, Ken, I'll send it back to you.
Thank you, Laura. Maria, you can drop the screen. Just 2 quick questions, Laura, related to some of your content. 1 mask or 2?
Right now it's 1, as long as it's a 2-layer mask and it fits nice and snug.
Okay. And then I know you addressed this, but there was a specific question about our faculty. Are they any way they can get a vaccine before the return? I know there's 1A, 1B, 1C, and 2, and I don't think that's a possibility, correct?
At this point, no.
Okay. Thank you, Laura. I know that's the million-dollar question about the vaccines and when the clinic's going to come back to campus. I wish we knew, but as soon as we know, everyone here will know. All right, Sue, we've had some questions about, what does summer and fall look like? We're always planning ahead, so take it away. I know you have more optimism to share.
Indeed. Hi, folks. It's good to see. Well, know you're out there anyway. It's been a while. I always enjoy, getting in touch with the campus as best we can in these days. So I'm here to talk. So I'll give you a preview of the summer and the fall. The adventure continues is one way to put it. One important thing I want to start with is that it's kind of been a Dearborn tradition. Usually we schedule and register for summer and fall at the same time. And we're not going to do that this year. And this is actually something that we'd thought of changing pre-COVID. And so what we're going to do instead is to follow one timeline and pathway for the summer and one timeline and pathway for the fall. And this has the, I think, very happy outcome is that for the fall, it allows us more time to see, just how the pandemic situation's playing out. As we all know, it's still transitional and still uncertain. Summer, though, summer 2021, we're set for it. The schedule is still being built, but right now we are looking to be about 12% or so in person. There'll be a combination of fully in person and hybrid classes. We plan to publish the summer schedule on the Ides of March. That's March 15th, my birthday, by the way. And registration will begin, COB, early registration, March 29th, regular registration on April 5th. So that's the summer, and we're well in hand with that. Now, Where we'll be in the fall, it's still a guessing game. There are indeed some positive indicators floating around, as you heard from the Chancellor. I can attest that Laura is all over this, hand in hand with university, county, and state experts. Right now, as you all know, we are highly constrained by the Center for Disease Control guidelines on social distancing. This overarchingly reduces our classroom capacity significantly. And of course, we're constrained by the limited vaccinations to date. But these parameters could indeed change for the fall. There could be modifications to space restrictions, better rates, and more widespread vaccinations. So as always, we are preparing for more than one scenario, varying levels of on-campus density, lower if restrictions remain in place, higher if they're modified or indeed outright lifted. And of course, we'll be tracking vaccination rates as well. We all have deep and great hopes that fall will bring us back more firmly to campus and to the campus experiences we all treasure, but we will only do it if it is safe. So you will be saying, when is that call to be made? Again, by decoupling summer and fall, we were able to push back the decision date on the fall final decision. We're aiming for an early May decision date for senior leadership. We'll choose one of the scenarios, the one that fits best on the table, and we'll publish the course schedule later in May and kick off registrations in early June. Now, I realize, and I'm sorry, that, yet again, this all indicates continued uncertainty as we find our way forward. I will say that we're all trying hard to be what we keep asking you all to be, and that you have indeed been, which is informed, inventive, accommodating, and flexible as we continue to deal with this together. Now, it has been, just to close, I'll just say it's been a while since we've had some listening sessions, like it's been a while since we've had a town hall. I enjoy the listening sessions, and I hope some of you do too. So I'm going to be putting out an invitation for faculty and staff to sort of convene and to talk through ongoing concerns. But, and perhaps even more importantly than that, I think we also have to start to talk about what's next, what will or what should the Dearborn campus be like, feel like, look like in the future? What have we learned from the COVID experience? What should we preserve? What did it really hurt us to have to give up? I think these questions were bubbling up in some of the questions that were sent to Ken ahead of time. And I think these are essential conversations to us to have. I'm sure many of you are already having them with your colleagues, friends, and family. And we'll be starting some listening sessions to get that discussion going soon. With that, I'll be quiet and hand it back to Ken.
Awesome. Thank you, Sue. I guess with all this change, it's job security for all of us, right? Keeping up with the changes and communicating them out. So
Well,
there's the upside of all
one
of
way
it.
to put it, Ken, Yeah.
Okay, great. Thank you. Just a reminder for people on the webinar, please use the Q&A tab, not the chat tab, if you have a question for us. And with that, we're going to start with the Q&A. I'm going to start with the questions that we have received prior to today. Sue, you alluded to this, but I think we have Rima on the call to address some of these HR related. A very common question that we received. People want to know, can they keep working from home even when we do return to a more sense of normalcy? And then a sort of a tag on question with that, Rima, is the university looking at doing things differently with space? If more people maybe are working from home, and could there be a shared space or a pod for faculty or staff to come in, and maybe they might not need their office anymore? And I know that's way in the future, but I know that there's been conversation about that here.
Yeah, absolutely. Hi, everyone. I'm Barry Hung in Human Resources. For those of you that don't know me, happy to be here. Happy to tackle all the HR questions, even the hard ones. So going back to the questions you asked, absolutely, we are definitely thinking about what the future of work looks like. And for those of you that have been involved in strategic planning, even prior to the pandemic, you know that we've been thinking about what we can do in terms of what the future looks like in terms of creating remote and hybrid options for people, right? And one of the silver linings of this pandemic, as difficult and as challenging as it's been, is that it's taught all of us how to work in a space that's not necessarily on campus and in our offices. And so we are absolutely looking at all of that. The senior leadership team of the campus is right now getting ready to embark on job assessment needs across the varying units to determine what positions can be remote, hybrid, or a combination of. You know, I acknowledge the fact that not every position can be done remotely, right, or in a hybrid manner, but we're going to look through all of that, including how we do our jobs, leveraging the technology, and even looking at physical spaces. So the question about, you know, giving up an office space, maybe, maybe not. We're definitely going to look at that. It's going to require a lot of flexibility on our parts, being adaptable and of course, really creative. But I'm actually really excited about that. And I think it just holds a lot of great opportunity for us. Did I answer the question, I think?
I think so. Thank you.
Okay.
Thank you. Question, can a student opt out of in-person classes? Sue?
Yeah, that's one for me. One thing just to say up front is, you know, we've already been making accommodations for students during the pandemic, for students who have a valid medical reason not to come to campus, or if there isn't a compromised family member, and we will of course continue to do so. Now, we've been working, and we will have to work through such requests on a sort of a case-by-case basis and find ways forward. In some cases, there may be a parallel online section to a non-campus section, and the student could, elect to stay online. In other cases, we can seek alternative courses where possible, so students can continue to proceed on their pathway to graduation. In other cases, lecture capture may be feasible. And ingenuity has stepped in other cases still to find a way to allow the student to proceed and not be penalized. So in other words, different solutions are going to have to be pursued. We are committed, just to repeat, to supporting students who cannot come to campus due to personal or familial health concerns. I'm going to be working with Dean Finley about messaging students who have such concerns that they should start with their instructor to discuss things, just to establish, what the situation exactly is, and if necessary, make a request about not being in person to the instructor. Well, but also please, we're going to suggest that they reach out to the department chair as well, so we can act on these requests in an efficient and a coordinated fashion. And then, as always, faculty are encouraged to connect students to our super duper Dearborn COVID support coordinator, Maddie Drury. If you haven't heard about Maddie, she's been great and right on it when students have questions or faculty raise questions. She's providing, along with the rest of the student affairs team, continuous and various forms of support to students. And this is important because if a student is having, an academic issue, it's very clear that these things aren't happening in isolation, and we really want to do everything we can holistically to support, the student and their ability to be successful. And Amy, maybe you can pop the phone number and the phone. Yeah, happy to give you a shout out, Maddie. If you could pop the phone number and the email in the chat, that would be great.
Awesome.
All right.
Thank you, Sue. And I'll stay with you. Another question came up about administering exams in person on campus.
Yeah. Yep. Yeah. No, believe me, we've heard people's concerns on this for quite some time now, and are sympathetic for summer and fall. I'll remind you that we are making available a limited number of rooms on campus, and those are for midterm or other in-person exams during term time. And those are, those are for faculty scheduled to teach the famous ONMST, the mostly online band of classes. And just remind you that that's where instructional activity is 75% or more online, but there is some on-campus activity. We will be asking faculty who want to take advantage of the on-campus exams to come to campus to supervise and to monitor the students during it. If this is something that's very important to you, faculty should consider, and faculty should speak to their department chair about scheduling your course in that kind of hybrid fashion, and using the days and times that you'd be teaching on campus to administer the exam. For those of you teaching fully online, we continue as we have, working with the hub and others to encourage the development of other forms of assessment that that make an on-campus presence less essential. Now, about final exams, we're still working on final exam guidelines for summer and fall. We are very cognizant of the desire of some faculty to have on-campus in-person final exams. For the winter term, we gave faculty who were teaching online synchronous courses the ability to make a request to the registrar's office to have the final exam scheduled as a synchronous exam on an exam day. We anticipate, and that seemed to go well, we anticipate doing the same for summer and fall. Beyond that, we will continue to explore ways to accommodate faculty hopes for more in-person exams as we balance, again, the realities of our space constraints, as they stand now and as they may change, the constraints imposed by COVID. And I know this is a hot topic, and we are constantly thinking about and trying to think of ways that we can accommodate as much as we can.
Thank you, Sue. Laura, a couple questions coming up on the vaccine again. One is, I thought Michigan Medicine was going to contact people about their vaccine time. Are we saying that's not the plan and people should look elsewhere or in addition to waiting for Michigan Medicine? Any advice or guidance on that one?
Yeah, thanks. As in my remarks, I think Michigan Medicine is going to do the best that they can to accommodate everyone. And there really has been a shift in the way that vaccines have been distributed. So where the healthcare systems are getting a majority of the vaccines and the public health departments less, there was a shift about 3 to 4 weeks ago where that has actually been in the reverse. So we've actually been seeing across the healthcare systems, not only Michigan Medicine, but I think even Beaumont went public either early this week or late last week that they had to actually postpone some of their second vaccines because they did not receive enough. So, you would still get, if you're in the queue to get an appointment and an invitation from Michigan Medicine, don't cancel that. But, my recommendation is moving forward, do try to get on some other lists and see if maybe you can get a vaccine somewhere else a little bit quicker.
Next question, Laura, possibly you, Chancellor. There's questions about, are vaccinations going to be mandatory and a condition for people returning to campus? Or maybe you, Rima, I see you nodding your head as well.
So at this point, there has been no conversations about the vaccine being mandatory. Again, I think as more information becomes available about the vaccine and, even how the vaccine helps transmissibility, I think we just have to wait and see. But for right now, it's not going to be mandated.
And then just sticking with the vaccine, is anyone aware of any work, any push at the state level, making university employees essential or somehow getting them, maybe we'll be 1D on the list?
Well, Ken, you do remember that earlier, a few days ago, we met with Representative Hammoud, and I mentioned to him that our faculty were not prioritized, and I would appreciate it if you would check into that with the state health department. He was actually quite surprised that they were not prioritized, and he said he would advocate for us. I don't know where that stands, but that's about as much information as we have at the state level right now.
There was a question, can summer camps for K-12 students take place on campus this summer? Laura, I believe the answer is no.
That is correct. The answer is no, not this summer.
Though on the brighter side, not speaking to K-12, but the summer undergraduate research experience, or SURE, which is now being organized out of Experience Plus in the Mardigian Library in partnership with the Office of Research. That's going to be a go. And in fact, are we doubling, Maureen? I can't remember. We're having more students involved. It will be done virtually, but we have faculty on this campus who have done sort of summer research experiences virtually. Shout out to Eunice in math and statistics on this, among others. So that, but on person for K-12, no, but our students will still be having summer opportunities, and we're eager to boost those.
Thank you, Sue.
Mhm.
Domenico, maybe this one's for you, but faculty and staff want a raise. So any insight on if merit is going to take place this year? I'm one of those people too.
I think everybody on this call would probably be in that camp, Ken. And we can talk a little bit more about this at our upcoming budget town hall meeting on March 1st with the Vice Chancellor for Business Affairs. But I can tell you that this is one of the things that we're trying to build into our budget model as we go forward. But we had also had it built in last year as well. But because of revenue shortfalls and many other exigent circumstances, we had to walk that back. Right now, we're hoping that that is going to be something that we can accommodate in our budget model going forward. But we have to see where tuition revenue comes in, state appropriation comes in, where our costs are, and but that is a high priority for us because we know that impacts morale and living conditions, and we're very committed to it. But we're keeping all of our fingers and toes crossed at the moment.
And so are 313 people on this call.
So I'm sure many more that aren't on this call as well.
Thank you. Sue, I'm going to go back to you. Is the university planning on making more rooms with recording equipment available for recording live lectures to meet student demand for flexible schedules?
Yeah, no, that's an interesting question, and it's come up in a couple other settings, like in the really good conversation the Chancellor and I had with the LCC and LPA in Castle. And I think I'm still trying to understand the question better to see what the hope and the goal is to answer it fully, but I can make a stab. I would say that we do have 2 digital recording studios on campus now. One's in the Mardigian, the new recently opened one in the Castle building. We also have, as you know, classrooms with lecture capture facilities, which are available and reservable. And if you have questions about how to sign up for those and when they're available, I think that's all on our COVID website. So, but if that's the intention, sort of straight lecture capture, just recording yourself, giving delivering, that's kind of widely agreed not to be the future of online education. And I think the campus, even pre-COVID, has been moving away from it in recent years towards, more innovative online practices. And, again, the hub has been terrific at bringing through a series of speakers and running a series of events to, introduce new ways to humanize and enrich online learning. And, not least by, ways to make it more engaging for students and faculty alike, which is often where things break down. Now, I did want to say if what's underlying the question is and what's being thought about here is the Hvac model of teaching, which is when some students are in the classroom and some are watching online simultaneously. That many schools are doing this, and it does sound appealing and efficient, but it's also very clear that Hvac can be deceptively difficult to do well. There's challenges around alignment of technology and curriculum, about consistency of technology for everyone, everyone in the class. That can lead to, upgrades, installations, testing, staff support. and, more importantly, perhaps, for all students to participate equitably. There has to be a lot of monitoring of chat and make sure everyone can hear and respond well. And all in all, it seems to sort of sometimes put a double burden on faculty. They're teaching two different populations in one class. I'm happy to talk more about Hvac, and again, the hubs are the experts, but that's kind of, if that's where the question is going, I think we should think about it. So
you would welcome a follow-up email from that individual?
I'd be very, yeah, I'd be very happy, because I really do want to make sure I understand it. We have and I've discussed this issue with our chief information, with Carrie Schumacher, and with the hub, and with my associate provost. And I think we're just eager to figure out exactly what we're asking for, and then see if that's the direction the campus should go, and if it makes good sense, how to accommodate that.
Okay. Well, thank you.
Mm.
Next question. Where can students go to pick up a parking pass if they're returning to campus? Amy, I don't know if you can answer that. I actually forgot the answer to that question. I knew in the fall.
I think I'm going to turn it over to Carol.
Okay.
I knew that was coming.
There you
All
go.
right, so some general reminders. If you aren't coming to campus, you don't need a parking pass this year. If you are a student or faculty member coming for a class, you can pick up your parking permit at the screener station when you check in. If you are a new student or staff or faculty member, you can get a parking permit when you get your M card. And if you are someone not covered by any of these eventualities, if you notify Bonnie Sutherland at umd-parking@umich.edu, she will make sure that you get one. So these are our COVID processes for this year. And that's all on the parking website, by the way.
So Carol, just to clarify, if you're coming to campus and parking your car in the parking lot, you need a pass, but you don't have to pay. There's no.
Yes, that's true. You don't have to pay this year.
Great. Hopefully that continues. And then Carol, while you have the floor, this question came up, I remember in the fall, but question about our HVAC systems. So have professionals evaluated the ventilation in all the buildings? And is there any type of report, that can be shared with the campus? Is it on a website that people can review?
Yes, so HVAC systems are fairly complicated. On our website, we have some frequently asked HVAC questions that's on the EHS COVID website. Our HVAC systems are designed by professionals. We maintain them in accordance with the design requirements. We also have some work specific to the COVID pandemic. So some things that we're doing specifically are, before we open any building, we purge it in occupied mode 24/7 for 7 days. We've also disabled the demand control ventilation in all of our buildings that have that, so that it runs in continuous occupied mode regardless of how many people are in the building. We have, as a matter of course, a 2-stage filtration system that gets us to MERV 13, and our post filters, so our pre-filters are at about MERV 8. But these are the types of recommendations that have come from the both ASHRAE and CDC, and they're just part of our standard operating procedures.
Thank you, Carol. I'm laughing. I think I did not understand about half of what you said, but it sounds
I'd
like
love to talk
people-
facilities.
No thanks on my end, but thank you. Laura, maybe for you, a question. If a student tests positive for COVID in an in-person class, will the in-person class continue or shift out remote? And I think there's some new guidelines that the extension of the quarantine or the distancing and quarantine is in effect for this spring, correct?
Yeah, and I'll actually let Amy address that.
Sorry.
Okay, thank you. Well, I know we've already brought up Maddie Drury, our Dearborn COVID support coordinator, but I think it's important to mention her in this context as well. So as soon as we learn of a positive student, within an hour, there's an emergency team that gets together to assess the situation and understand what the appropriate next steps are. So this is true even when we have a concern that a student is positive, but we don't yet have a positive test result. And so that led us to quarantine 4 classes in the fall, for which we had information that was sufficient enough for us to say there was a risk. And I think what we know is that if you look at the dashboard online, our low numbers are a result of the hard work of a variety of people. Laura and the emergency management team, folks on my team, Maddie and Tyler, and all across the institution that come together quickly to assess what's going on and figure out the right next steps. And so we continue to do that, and we will continue to do that. And it's working well. So as we have thought about it and ways to improve, you know, we're not fixing it because it ain't broke, but we are taking excellent precautions to make sure that even if there is a risk, we are going to quarantine a class quickly.
Thank you, Amy. Just a reminder to people on the webinar, please use the Q&A tab for questions, not the chat. Question, how do people know if they're in 1A, B, or C, or 2? Where do they go to find out that information?
So Ken, some of that information is on the MDHHS website. They actually have a breakdown. So 1A category actually covers those individuals in healthcare and long-term care residents and the staff in those long-term care facilities. 1B is broken out into like 7 subcategories, and it's nicely identified on that state webpage. For the purposes of, and I'm assuming maybe the question is more directed at how Michigan Medicine makes that determination, there's kind of a couple things that factor. The responses to the Blue Q questionnaire that folks would have filled out, as well as the job title and job description of the individual.
I will add, if you just go into Google and type state of Michigan coronavirus, the state has a great site put up with a lot of easy to understand information. And I think it's very clear it's easy to find that information there as well. It's a good resource. There is a question about enrollment, but we're going to hold that to the town hall that the Chancellor alluded to in about a week or so. It's going to talk about enrollment and budget and everything tied to that. There is another question. It's far-reaching, but in general. But what are the big takeaways? What has the university learned through this experience? I know we've talked about, Rima shared that from an HR standpoint, maybe people will be working from home more often, and office space will look different. Is there anything else? Any of the senior leaders, on the panel that maybe you learned, or things that we're going to be exploring as we go forward through the pandemic and beyond?
So I think definitely from the HR perspective, you touched on it a little bit, Ken. I would also add that exercising a lot of flexibility and being adaptable and able to change at the drop of a hat has become really important, because as we've seen, things change on an hourly, daily, weekly basis. And so I think a lot of what we've done has just shown our resilience during very, very difficult times. It's allowed us to think very creatively about how we do our work and how it intersects with one another. And even though we can't physically be on campus face to face in a traditional sense, it's allowed us opportunities to explore new ways of doing the work. And I'm grateful for that.
Yeah, I thought that was a great question, and one that I think, we're all sort of ruminating on in the back of our own minds, but we do have to find some venues to start putting our heads together about it. And again, these listening sessions can be one opportunity for that, but I know there's a lot of other conversations going on campus around strategic planning and diversity, equity, inclusion efforts, and the Care and Equity Task Force. Give them a shout out. And so in any meeting that you're in, maybe raise that and see what folks think. My sense is that, one thing that we're going to take out of the COVID experience, is the importance of sort of prioritizing high impact experiences on campus, when you really want to have face-to-face dialogue with a student, when the practical work, engaged activities, stuff that you really just can't effectively and meaningfully do remotely. And, we may want to consider if, just content delivery through lectures without a lot of student engagement, is that something that could, at least in some cases, stay remote and asynchronous? And then we prioritize the time of our students when they are on campus to be more interactive, more dynamic, and more engaged. So that's kind of a, and we were sort of moving in that, thinking about that before COVID. COVID, I think, has definitely accelerated the thinking, but it's not forced on us by COVID. It's just accelerated. So that's kind of my 2 cents. I don't know what others think.
I agree with everything that Sue said. I think that we've slowly started to uncover ways to be more efficient in a lot of the things that we do. But I think it's also shown a light on how important our human to human interactions have been, and that we've lost those. And there's a sense of loss among our community because we are not face to face. And I think we took a lot of that for granted when we weren't faced with a healthcare crisis. But now I think that we're going to be more aware, acutely aware of that, and take as much advantage of that as possible. So I think that we did find transactional ways of doing business better. There's no question, but I think that it's also shown a light on what we lost through being remote for such a long period of time.
And if I could just add to that, I would say it also evidenced the great care of our faculty and staff for our students, and also our students for our faculty and staff. I'm overwhelmed literally by the number of emails I get from faculty and staff who notice something in the classroom or in an interaction and are worried about a student and want to make sure that somebody is following up with the student to let them know of the campus resources. So we are missing that human connection, but we're finding the ability to help each other and support each other in different ways, which I hope is a message that will carry forward with us. It's not surprising to me. We've always felt proud of the community of the University of Michigan-Dearborn, but I think it's even more evidenced at this time. And I would also say that as a commuter campus, I'm proud of much of the work that we did in person before, but we now have been seeing that it can be successful in virtual ways. So there might be opportunities for students who are navigating jobs and family responsibilities to Zoom into an academic advising appointment if they can't or weren't planning to come to campus that day. So I think it's just opened the door to some new flexibility, which is really beneficial to our student population.
Ken, I would just say, and I know we're not going to make Melissa reveal herself and talk about enrollment till the next town hall, but the question about our students feeling, the lack of, we have students who've never been on campus, and that is something we're thinking about for incoming students next year, but also for the students who started last fall, and thinking about possible prioritization of some experiences or classes that target those, just to begin to build that sort of campus connection for them, because it's it's been tough on everyone, but I think we have to think about that particular population pretty hard.
And, I would add too, we're all experiencing things differently, and I'm sure people are going to have great ideas on things that we can do differently. And I just think this story is going to continue to evolve. And, I think everyone's all ears. If you have ideas and suggestions, share them and write them down, and, whatever it takes. And I'm sure there's, as, Sue mentioned, and the Chancellor, with the strategic planning process, we have a whole new mindset going into that, based on the past 12 months. So. Okay, we have 4 minutes left. So I think at this point, I want to thank everyone for joining us today. A special shout out to Anitra and Maria for being on the back end and making sure this all works, and it always does. This has been recorded, so we're going to send this out to the campus hopefully this afternoon, if we can pull down the recording quick enough. If not, it will definitely be up by next week. We are going to start weekly communications from the Chancellor and the Provost on Fridays. It's something that we did in the fall. So we're going to resume that as activity on campus increases. We talked about the budget town hall meeting. So save the date for March 2nd. It's March 2nd from 1 to 2 o'clock. An email will go out next week. I think we've all had enough emails this week on other things happening. So we don't want that to get lost in the shuffle. And just before we close, Laura, Sue, or Domenico, anything to add?
Yeah, I do want to add one thing. I want to thank profusely Ken and his team for pulling this together, arranging all the right people, identifying questions, making it seamless, and getting our community plugged into everything that we're doing. Communication through this crisis is critical to our success. And we've been very fortunate on our campus. So we've got a great communication team, and this is why we've been so successful. So I just want to give a big shout out to Ken and his team.
Thank you. Laura or Sue, anything to add?
Thanks for making us look good, Ken. And thank you everyone for coming to the town hall. And as always, if there's remaining questions or concerns, you know where we live, and you have my email.
Laura, anything, Laura?
I just want to say thank you to everybody, and thanks for all the effort everyone has put in. It's definitely a lot of folks even behind the scenes that do a lot of the day-to-day heavy lifting that goes unrecognized. So thank you to everyone.
So Sue, with this group of people, not only on this panel, but also across campus, there's a lot of good talent to work with. So you all make yourself look good. I'm not doing a whole lot. So thanks, everyone. It's 2 minutes. We all have 2 extra minutes. How about that? See, optimism and positivity. So I hope everyone stays safe, stay warm, and go blue.
And go Dearborn.
Go Dearborn. Bye, everyone.
Bye-bye.